Susan and Kim stood quietly in the vascular theater as the anesthetic team finished their checks. The patient was already asleep, monitors gently beeping. Kim glanced at the operating list. Femoral popliteal bypass, she said. I understand it's for poor circulation, but I'd like to really understand what's happening. Susan nodded. Good question. This is a cornerstone vascular procedure, so it's important you grasp the basics. She spoke softly, mindful of the sterile field. A femoral popliteal bypass is a surgical procedure to reroute blood around a blocked or severely narrowed artery in the leg. The blockage is usually due to peripheral arterial disease. Kim followed along carefully. We're essentially creating a new pathway for blood, Susan continued. The surgeon connects a graft from the femoral artery in the groin to the popliteal artery behind or below the knee, bypassing the diseased section entirely. And this is done under general anesthetic. Kim asked. Yes, Susan replied. Unlike fistula surgery, this is a major vascular operation, so the patient is fully asleep. It allows the surgeon to work safely and precisely for a longer period. Susan gestured subtly toward the instruments. The graft can be the patient's own vein, usually the lung. Safino's vein rests in Zupal. Kim's brow furrowed. How do they get the graft from the groin to the knee? That's where tunneling comes in, Susan explained. A tunnel is carefully created under the skin between the two incision sites. The graft is passed through that tunnel, protecting it and keeping it in the correct anatomical position. She added, the graft is then sewn onto the artery above and below the blockage. Once clamps are released, blood flows through the new route. Kim nodded slowly. So it's all about restoring circulation to prevent pain, ulcers, or even limb loss. Exactly, Susan said. That's why vascular surgery is so precise. We monitor pulses, blood loss, graft patency, and limb perfusion closely, both during and after surgery. Susan looked at Kim and smiled. If you remember one thing, remember this, we're not just bypassing a vessel. We're preserving mobility, tissue, and quality of life. Kim straightened her shoulders. That makes it feel very real. Susan nodded. It always should.